integrated with psychosociology and neuroimaging IMRI, fMRI, and EEG. Beyond the laboratory, she enjoys writing novels, theological studies, good company, and good food. Welcome back from the break. Today, we are assembled here for day 4 of Metaverse Safety Week 2022. And the focus is medical XR and immersive healthcare. The new role of clinicians, nurses, researchers, hospitals delivering medical care. Let's listen into a fireside chat around patient health and safety. How will immersive healthcare infrastructure transform patient care with Joey Ka-Yee Essoe? And I hope that I said that correctly. Joey is a medical XRSI advisor at XRSI Medical XR Council and also research fellow at Johns Hopkins University School of Medicine. Dr. Essoe is a cognitive neuroscientist and experimental psychologist specializing in learning enhancement. Her research at Johns Hopkins applies learning enhancement strategies to optimize evidence-based treatments for childhood neuropsychiatric condition, example, tic disorders, anxiety. Her research uses technologies such as immersive VR and mobile apps that are integrated with psychosociology and neuroimaging, fMRI, EEG, etc. Beyond the laboratory, she enjoys writing novels, theological studies, good company, and good food. Joining Dr. Essoe is Brian Cameron, another Medical XR Council advisor at XRSI, founder of Electric Puppets, Inc. Brian Cameron has been a serial innovator since 1997. In 2000, Brian led a team to create first interactive version of the beloved Little Golden Books for Disney Interactive, and then became the CTO of an international US-based firm that delivered online education to Fortune 100 corporate employees. For the next 10 years, Ryan was CTO of online education companies before starting his own innovative online education organization. He's advised on international boards and organizations as well. Ryan has created online education products that have won numerous awards and have helped hundreds and thousands of Fortune 500 employees learning important new skills in multi-year award-winning online programs. Joining Copernicus Studio in 2013, he led the interactive division, creating one of the first speech recognition engine tuned to children's voices, and has created first patent-pending medical VR platform research and assessment starting with ophthalmology. Sorry, that's why I need medical advisors. I'm bad with these terms. Thanks, Ryan. Ryan is an avid rare book, art, and antique collector, lives on a acreage of Chester, Nova Scotia, and I also have the honor to work very closely with Ryan on a very remarkable research, augmented reality, for natural authentication for augmented reality for public safety. So without further ado, Ryan and Joey, please take it away.
Thank you. Hi.
Thanks, Kavya. So, yeah, that was great. Thanks for that introduction. So I just wanted to start off by welcoming everyone here, as well as Joey in particular. And we can talk about a little bit about Joey's work and what she's been up to over the last few years. I believe using OpenSim to research psychological effects and treatments with youth, particularly in the sense of with PTSD context. So, Joey, do you want to clarify or just maybe describe your work
Yeah.
accurately?
Yeah, so a lot of our work when I was doing my dissertation was with OpenSim. We work mostly with Unity now, but the key is the same, right? We're studying learning and memory using virtual reality as well as to enhance it. So why am I, in a psychiatry department? Is that there's a lot of learning and memory in psychotherapy. So you're basically learning new skills, learning new way to think, new way to interact with the environment that is more functional than the pathological interaction you had before, right? So for the most obvious is kind of like a phobia type, more like a phobia type oh, sorry. With like phobia, for example, you learn that something is scary, and then in therapy, you will learn that with with your therapist, you can learn that something is less scary, or something like kind of like Sorry, it was a little distracting. So
The floating
in
person
therapy,
is the
you'll
camera, in case you're wondering.
oh okay. I was like,
Yes.
what is that person doing in my face? Sorry about that, guys. So in therapy, you'll learn, for example, your therapist will walk you through how to interact with like an image of a dog or a video of a dog or a real dog. And then through not having additional traumatic experience, you'll learn that, oh, okay, dog isn't scary, right? So our job with virtual
Mhm.
reality is to kind of make that first step a little bit easier to for people to interact with things that might be really, really scary in real life. But a virtual dog, you're more likely to be willing to step into the room with it. Does that kind of make sense?
Yeah. So where I got interested in talking to Joey in particular was just where she had worked with so many different patients. And in my case, I'm working in a vision clinic with ophthalmology patients, mostly
Right.
pediatric, so children. Um, we wanted to explore this idea of health and safety that was unique to virtual reality. So, what are things that we're learning, especially with Joey's work
Mhm.
in working with people in PTSD and trauma? What are things that we need to do as VR developers to make the environment as safe as possible, as welcoming as possible, and really getting that parasympathetic response in a good state so that we can
Yeah.
do research and administer therapy.
Yeah.
So yeah, so I wanted to see, Joey, if you had any learnings from what you were doing that relate to patient
Yeah.
safety at this point.
Yeah, so I work mostly with children. So a lot of times with kids, just like in the real world, right? You want to talk to them in a way that they understand. Um, both like if they walk into your hospital room, they might be a little nervous. They obviously might not be feeling well. Your first of all, the bedside manner, I think, is the first thing that put them at ease. So, for example, in our research, we never wear lab coats because lab coats is intimidating to kids. And when during COVID, we have to start wearing mask and face shield, which is super scary. So what we started doing is, well, I started doing, I started putting weird decorative stuff on my mask and on my face shield so that I look less like an alien, just like a silly, lady. Um, Being a little silly always help. And so before we even put the headset on the children, we try to talk to them and walk them through kind of what we're doing, why we're doing it, and what they will see before, like we basically prevent them from seeing any other stimulus, right? Yeah, and I think that's
Yeah.
similar to kind of what you have worked with before as well.
Yeah, so some of the concerns that we came up with as we were talking were that the
Mhm.
lab coats thing. I was thinking in terms of like, should you have a horizon? Like, do we have to be able to see a
Yeah,
horizon out there in VR in order to keep a person feeling grounded and not getting
right.
nauseous? Or
Yeah, yeah.
do we, yeah, and do we need to, is there certain colors or certain light levels that we
Yeah.
should be thinking about? So in our case, we didn't necessarily find all the answers, but we just started talking about it. And
Yeah.
what it's resulting in is, we've just been going around asking people and trying to get people's experience because we think at some point, if we can,
Mhm.
we can kind of put all this information together in one place, it'd be something that we could disseminate and people could start, whether you're developing for healthcare or just anything, you could have a reference that would help you understand, like, okay, if you're going to make something for kids, you should have this, these are best practices, don't do this, avoid this, so that was kind of where we've gone with it.
Yeah. And usually like comfortable rooms, right? If you're going to be indoors in the VR, comfortable rooms instead of like medical setting, like tend to also put people at ease as well, especially kids.
Yeah. So my question is there a standard? Is there like something that we can create that would be useful to everyone in the medical community, but by extension, other kinds of research, as well as, even in gaming and other things where people obviously you want people to feel safe in VR and feel comfortable so they can enjoy whatever it is they're doing.
Yeah.
But that takes research. So that's where
we're trying to do that research.
So we're kind of trying to start something ourselves, but also reach out to people here who might be interested. Certainly, if anyone here is interested in contributing or taking part in the conversation we're having about these very specific things, especially if you've had a lot of experience interacting with people in VR and doing research, and just having lots and lots of people go through with the headset on and watching what seems to work, what seems to cause them issues. We're just hoping to get that documented in a central place.
Yeah. So let us know if you have something to contribute.
Yeah. So I don't know, do you have any interesting anecdotal stories about any particular experiences that you could share without violating patient, confidentiality?
Yeah, I've there was one time where we were putting the headset on a child. He has tics, and the study we were doing is kind of how one of the study we did before is how children with certain disorder learn and unlearn fearful memories. So because that is a very key concept in psychotherapy. So what we did is we put the headset on the kid, and then they walk through this VR, and then they're supposed to interact with these lamps that occasionally it was like scream at them. So this kid, he hated the scream so much that he shrink in you can see my shoulders, but he shrink in his chair, and then eventually he threw this squeeze ball that we gave him. He threw it at me, and then he said, "Stop making it scream." But so obviously that was like it's distress-inducing situation. And another thing that we learned that some of the commercial software that one of my colleagues was using that kind of try to help children relax during painful procedures. So one of the problems that they encounter with commercial software, which speaks to why we have this kind of collaboration, right? You have researcher and developer working together instead of trying to get something off the shelf, is that a lot of the procedures are done when a patient's lying down. And a lot of the commercially available software at the time with the Oculus Quest 1, I believe, when you look up, all you see is the sky. So all the lovely stimulus that's supposed to help them relax is over here, and the kids is looking up at the sun in their face. So that was a couple of the things that really, really motivated some of what we're doing now, right? Like to kind of figure out what is it that the medical community need, rather than what is available, and how do we make them better? How do we make them safer? How do we train people to make them safer? And like provider training, I think, is really important in this regard.
Yep. Yeah, for sure. And then there are some beyond just VR design, which is certainly where I'm really interested. There's also the idea of just like, what do you do with the data, and how, like I noticed this morning with Brennan, he was at the keynote, he was talking about keeping the data local to the machine, so nothing went on the cloud and nothing. It all stayed on site.
Yeah.
So certainly keeping things on device, I think, is helpful. That's certainly what we're doing with electric puppets when we're conducting our research at the hospital. That's really just a matter of the ethics approval stuff. Can't have data going off site, or all that process has to be subject to ethics as well, and it gets very complicated. Right. So yeah, these are other areas, but certainly and that's actually interesting because I just was at the OpenSim conference this weekend, and with the hypergrid, we've been talking about the idea of, pairing a patient with their own personal grid so that all their data kind of stays with them. And when they go somewhere or enter a different virtual world, they're always in control of their own data, and it's always being stored locally with them. So, that might be a really interesting thing that we could look at in terms of patient health and data safety. And I was kind of interested from you, like, if I'm a patient who's in this world or VR chat or something, and I've crafted my own look and my own identity, and then I go into a virtual world like Horizon Worlds, and I suddenly have to throw that away and be this, default avatar.
Right.
I personally have noticed that takes away a lot of my personal sense of agency. So I'm wondering about, in the future, if we can take our carefully crafted, highly personalized avatars like yours with the beautiful hair you spent some time on there, what difference does it make psychologically if a person has to throw that identity away and wear, in OpenSim we call it a Ruth, which is a generic,
Yeah. A Ruth, and I think there's a name for the boy as well, forget. So actually, what you just said reminded me of a different issue, but I'll get back to this. What about like protected health information, right? Our face, our real face is considered PHI because you can identify a person by their face. If you can now identify a person by their avatar, is that now PHI? Am I not allowed to show the avatar of my patient to somebody? Anyway, so
that's a good point.
So should we allow them to, should they all be roofs, right? So there's no no identifiable avatar. But in terms of sense of self, I think it's really important that like patients feel like they are part of what's happening, right? So right now I feel like I'm talking to you in this stage, but I can't see myself. Can see my hands, right? So like maybe does it really need a lot of detailed personalization if you have an interface that doesn't allow like a self view? Like because the sense of self is something that obviously is really meta, right? I am me, but like I only see this avatar when I log in. So like depends, like because I assume at some point if we do end up doing some sort of basically therapy room is between a patient and a therapist or a medical doctor, it would be something that is entirely private, right? Like you were saying, maybe like in a local network or a really private connection of some sort that only the two people are allowed in. And at that point, that avatar can be as personalized as they want. Maybe a person can have the same avatar going to the other doctors, And I guess it can be also used as another way to de-identify, right? So I don't know. Maybe one day I'll hear one of my colleagues say, I just gave therapy to a T-Rex today.
Yeah. Well, and that's interesting. And the reason I relate this is because in OpenSim, there's a whole bunch of different hypergrid or grids you can kind of hypergrid between. And I found that if I could be my own avatar in all these new weird worlds I found myself in, I felt a lot more present. Like it was really intense, the feeling of just, and then the times when I couldn't bring my avatar in for some reason, I had to take on a different, a generic one. I lost
like
that
you have some
sense.
kind of
And so
rules
I'm
or
wondering,
something.
Yeah, or you just don't feel like yourself, or you feel like you're kind of
Mm,
abstracted away from the experience
right.
in a sense, where it's like you're
I,
having to wear a uniform,
yeah. Were you in first person view or third person view?
Third,
In
which
the
is
okay.
interesting. So yeah, so
I
here
want you
you're
to do it
not,
all
and
again. Yeah. I want you to do that experiment again, but in first person view and see if like it makes a difference.
it would in terms of how people react to me probably, but yeah, you're
Yeah.
right. It would be
Yeah.
less personalized.
Yeah.
Certainly in Zoom, I guess we all get to see ourselves talking. So and most people probably do just stare at themselves more than everyone else in the cameras. I mean, I
I
do,
don't
I'll
know.
admit it, but
Well, that's why I prefer Google Meet. Like I'm out of the way, so I can focus on the person more.
that's
Just
true. Yeah,
automatically
yeah.
in the corner. Yeah.
So I think we have about 10 minutes left or so. So I thought I'd trying to keep it fairly informal here. So I thought I'd open it up
Yeah.
to some questions in case anybody had any. And if not, that's okay. We can continue talking or whatever you'd like. So just raise your hand if you have any questions for us. Or if it's not a question, you can certainly share some
Yeah.
experience that you've had that maybe is kind of related to what we're talking about.
Or some experience that you have interacting with VR and patient that can make them feel safe and keep them safe, like some of the ways that you have done has found you found to work or not work.
Yeah, I mean, definitely, probably we've all experienced the showing a person VR, and then the first thing they do is try to, when they play golf or something, and they end up running into a wall or, running over something and hitting themselves in the head or something like that. Certainly had that
Yeah.
happen on some of my demos.
Yeah. Yeah. Actually, I have less trouble with again, please raise your hand if you do have questions. But yeah. I think most of the time I find children to accept VR relatively quickly. Is that a raise hand? Did I see something?
Oh, yeah, Paula. Okay. Let's see. I think you're on megaphone if you want to go ahead.
Yes, hi. Thank you for this great
Hey.
presentation. Can you hear me?
Yes.
Yes.
Perfect. I wanted to ask Joey regarding the experiences that she has been sharing about kids. Do you work with only
Yeah.
neurotypical kids or also neurodiverse? How does
I
that differ in how
mostly
they can actually
yeah.
experience that?
Yeah, I mostly work with neurodiverse children. Most of the kids that I work with have tics, anxiety, or anorexia. Yeah. So how does it differ? I have only worked with maybe 6 neurotypical kids, so I'm not sure. I'm a very like yeah,
No, my
like the
question kind of links to an earlier
Mhm,
presentation where Brennan, how Ryan mentioned, just
mhm,
shared the patients that were really benefiting from that escape, right? That they were
mhm,
going to hospitals and really were
yeah,
taking advantage of that immersive experience to experience
mhm,
because they didn't have the mobility. But I'm wondering
mhm,
about the neurodiverse kids that have the sensory issues and how you tackle that. For
yeah,
example, a child in the spectrum. How do you let
yes.
them really enjoy and be benefited by this type of immersive technology with the challenges that they face in real life?
Yeah, so I have not worked with any children on the, I'm assuming you mean the autism spectrums, right? I have not worked with kids with autism, but kids with tics also have some sensory issues. So they tend to be like really sensitive to sound and touch, but not so much with sight. So, but most of the participants that we work with do tend to have some level of anxiety. So it kind of goes back to that bedside manner, like explaining things, being patient, using language that children understand. So for the most part, I feel like I'm not too qualified to talk about this because I haven't worked with neurotypical kids. You know what I mean? So,
Absolutely. Thank you.
because
Thank you for your
yeah,
for your information. Thank you.
yeah.
So I guess we're close. Anybody else have any other questions before we jump off? Or are we being signaled off stage here?
Hey guys, this is Kavya.
Looks like Kavya has. Yep.
Yeah, I honestly, not a real question because I know you both are advisors and I can always contact you directly. But I did want to, comment on, being gracious for sharing knowledge. Clearly, there is no financial incentives at the moment to becoming an XRSI advisor, but I really just wanted to thank you both for graciously sharing your insights, your knowledge, and making time not only to speak here, but also to attend these sessions, because every single word that is being shared throughout this week is essentially going to help us guide how we confront these new realities. So thank you so much for prioritizing part of Metaverse Safety Week. I'm really, really grateful to both of you and to the entire council members, as well as today we have a new leader for the Medical Council, Julia Scott. I'm so forever grateful to both of you and everyone. And thanks everyone for joining.
Very good.
These are some remarkable researchers who give time to us. Thank you.
Yeah, and
Thank
thank
you.
you,
I guess that's
Kavya,
my
too,
cue.
for all your work. I mean, it's amazing. So, okay.
Yeah.
Thank you, Joey. Thank you, Ryan.
Thank you.
We'll take a quick 5-minute break and come on back for our next keynote.